I'm going to show you how you can do a nose to tail check of your dog at home so that you can spot when things are normal, but also when things start to change, because the sooner we can spot any abnormalities, the sooner we can get them sorted out. As the name suggests, we're going to check our dogs over from nose to the tail tip. So starting at the nose, there should be no discharge, it should be lovely and moist. Then you're moving slightly further back to their mouth, lifting their lip up to have a good look at their teeth. Also, if you can, gently open the mouth to look around the tongue, look at the back of the mouth for any lumps or bumps, check their breath and make sure that there is not too much plaque on those teeth. We're then going to move slightly further back again and look in their ears. Ear infections tend to start with a nasty brown discharge, but also you can tell if a dog's ear is healthy or not by the smell. So this is one time where it's a good idea to get up close and have a good sniff of their ears. We're then going to check their eyes. So again, they should be nice and bright, fully open, really glossy and shiny. They shouldn't be cloudy, there shouldn't be any discharge, and they shouldn't look red. Then we can check their weight. The best way to check their weight is, of course, on the weighing scales down at the vets, but you can also do a check at home, which is called a body condition score. This is where you feel down their ribs. You ought to be able to feel the ribs nice and easily without seeing them, which would indicate they're slightly underweight, but you also shouldn't have to dig in too much either, which would indicate that they are slightly overweight. When you then look from the top, they should have a nice tucked in waist, and then from the side, their tummy should tuck up nicely up into their hips. Next, you're going to have a feel of their coat generally, so feel down their body. You're looking for parasites or any sort of black spots that could indicate flea dirt. You're also looking for ticks, but also any areas of infection. So that might be red, skin that could be infected, it might be a bit smelly, it might feel greasy. Anything like that would suggest we need to get a trip to the vets. Next up, we're going to check down their legs. Now, some dogs don't particularly like having their feet touched, so go at their own pace. But if you can, have a feel down each of their legs in turn, checking their joints for any heat or swelling or pain, and again, all the way down to the foot, and check their nails. Overgrown nails are really painful for dogs, and if you can, also turn the foot upside down and have a good look at their pads as well, checking for any abnormalities, any redness, and things like grass seeds that can get easily stuck between the toes. Whilst we're talking about the legs, it's also a really good idea to actually watch them move and watch them walk. So you're looking out for any changes in their gait. That could be lameness, it could be limping, they could be licking their joints. Also, check for any changes in their overall behavior. Are they happy? Do they want to go out for walks, or are they lagging behind? Are they lethargic? Are they withdrawn? Or are they really pleased to see you and jumping around as normal? Check for things like, are they eating well? Are they drinking normally? Is there any vomiting? Is there any diarrhea? It's a good idea to check in on your dog, of course, every day, but do a full exam maybe once every week or two, just so you can spot any abnormalities nice and early and get them sorted out. And of course, if you do spot anything abnormal, make an appointment with your vet and we can help you out.